Hi, I'm Amanda, doing a research project for my nursing program. I work on a med-surg unit as an RN, and catheter-associated urinary tract infections is a hot topic, especially for Joint Commission. My project focuses on what we as nurses can do to help prevent catheter-associated urinary tract infections. I believe this is a problem for nurses everywhere because urinary tract infections are the most common hospital-acquired infection. It has been estimated that 16 to 25% of patients hospitalized receive a Foley catheter. The daily risk of developing a catheter-associated urinary tract infection goes up 3 to 7% every day. It is always easier to stick a catheter in a patient, especially when they are not continent or on a diuretic, but it's not always what's best for the patient. We all know that catheters are a flexible plastic tube that's inserted into the bladder by using a sterile procedure to provide continuous urinary drainage. A catheter-associated urinary tract infection is an infection that occurs in someone who's had a catheter in place to drain urine from the body. During my research for this project, I've learned lots of valuable information from numerous nursing journals. One study I found was by the American Journal of Critical Care, focused on interventions to reduce catheter-associated UTIs on a medical ICU by decreasing the use of catheters. They studied 337 patients for a total of 1,432 days. They implemented an intervention to judge appropriateness of indwelling catheters. This study resulted in significant reduction in duration of catheterizations and catheter-associated urinary tract infections. Another study conducted by the UNC Healthcare Systems did a study with their main purpose was to reduce unnecessary indwelling catheters as well as catheter-associated urinary tract infections. They started a urinary catheter protocol which was very successful during the study. There was a reduction of overall unnecessary catheter usage. Unfortunately, they did not see a reduction of catheter-associated urinary tract infections. Another study found in the BMC Geriatrics made the purpose of their study was to determine the frequency of appropriate catheter usage. The percentage of elderly discharges with the diagnosis of UTIs, the percentage of patients who had indwelling catheters and were also diagnosed with UTIs, and the percentage of patients with no indication of UTIs who had a catheter placed on admission and later had a UTI. The study actually found that the strong association between catheter usage and urinary tract infections may be explained by the high prevalence of pre-existing UTIs prior to catheter placement. The study also showed that 73% of patients who received a catheter were elderly. On my board, I have a protocol right here for catheter indwelling insertion, maintenance, care of, and specimen collection. This protocol is used at my hospital, and it recommends that catheters placed postoperatively be removed within 24 hours. Catheters used in operative patients are to only be used when necessary and not routinely. Inappropriate catheter usage for this protocol includes incontinent patients as a mean for obtaining urine when a patient cannot urinate voluntarily, and prolonged post-op patients. In the protocol, sterile technique must be used when inserting a catheter. While the patient has a catheter, cleaning the area where the catheter is inserted using soap and water daily is required. Powders and sprays are to be avoided. Keeping the catheter bag below the bladder and avoiding pulling on the catheter is also required. Urine must stay free-flowing. No urine can pool in the tubes, and there can be no kinks. The catheter bag must also be kept off the floor. To empty the bag, staff must also avoid letting the bag touch the floor. Also on my board I have information from the CDC on how to prevent catheter-associated urinary tract infections. With the evidence I've received from doing this project, I've made signs for every nurse in my hospital and flyers for every floor that ask 3 questions. Why does my patient have a catheter? How many days has my patient had a catheter? And can my patient have their catheter removed today? Nurses at my hospital need to stay aware of how important it is to prevent catheter-associated urinary tract infections for our patients. I plan to work with the infection control nurse at my hospital and quality control on lowering unnecessary catheterization usage and lowering catheter-associated urinary tract infections. The infection control nurse comes to my floor every day and finds out how many patients have catheters. She also keeps up with how many UTIs and catheter-associated UTIs are on the floor. I'm going to see within 3 months if my flyer has helped keep nurses aware of catheter usage and see if the infection rates have become any lower 3 months from now. But this is my board, and here's some of the flyers that I've made for the hospital. The end.